A travel ban on Haiti extended. The demand for healthcare workers high, and police need help finding a woman for assault with a deadly weapon. Good evening, everyone. I'm Leah Cooper with your JCN News for this Wednesday, May 12th. The government extending its ban of any vessel or person coming in from Haiti into the Bahamas. A new Emergency Powers COVID-19 Pandemic Risk Management No. 4 Amendment Order 2021 signed by the Prime Minister on Monday of this week enforces this new ban as of today, May 12th, for another 30 days. The Ministry of Foreign Affairs, in a release advising the public that the suspension of travelers directly from or transiting through Haiti will continue as the Bahamas government has found it necessary to take this measure given the continuing uncertainties regarding the management of COVID-19 in Haiti. The government also remains concerned that the government of Haiti still has not accepted the AstraZeneca vaccine offered under the World Health COVAX facility and still has not put an alternative measure for vaccination in place. Foreign Affairs officials say as the Bahamas seeks to manage the spread of the virus within its own borders, the government, based on the advice of health officials, deemed it necessary to take this measure to prevent risks to the nationals and residents of the Bahamas, as well as visitors to our shores. This is now the third time that the ban has been extended since it was first implemented in February this year for 21 days. It was then extended in March and April. As countries around the world continue to battle with the COVID-19 pandemic here in the Americas and the Caribbean region, the demand for healthcare staff remains extremely high, and so does the demand for oxygen. This much coming from Director of the Pan American Health Organization, Dr. Carissa Etienne.
Based on how COVID is spreading, we estimate we'll need 20,000 doctors and more than 30,000 nurses to manage the ICU needs of just half of the countries in Latin America and the Caribbean. Our health workers are also facing mounting challenges as the life-saving supplies that they rely on, like oxygen, are running dangerously low. A typical COVID patient can require up to 300,000 liters of oxygen during a 20-day hospital stay. And patients in critical care often need double that. So it is no surprise that the rise in hospitalizations across our region are triggering an unprecedented oxygen supply challenge throughout the Americas.
Dr. Etienne notes that healthcare systems in the Americas are challenged to care for an influx of COVID-19 patients as countries scale vaccination efforts. According to Dr. Etienne, more than 140 million people in the Americas have been fully vaccinated against COVID-19 with both doses, including 1.5 million healthcare workers. However, she says that as vaccines remain in short supply, our healthcare system and the patients that rely on them are in danger.
Across our region, nearly 80% of our intensive care units are filled with COVID patients, and the numbers are even more dire in some places. In Chile and Peru, 95% of ICU beds are occupied, the majority by COVID patients. Buenos Aires, where 96% of ICU beds are in use, just tightened restrictions to avoid the collapse of hospitals. Some areas in Brazil have waiting lists for ICU beds. The rise in hospitalization has meant that our health workers are working overtime and juggling more responsibilities as they manage more patients now than at any other point in the pandemic.
For the second time this year, nearly 40% of worldwide COVID-19 deaths reports this week happened in the Americas. Dr. Etienne says that this is a clear sign that transmission of the virus is far from being controlled. Total COVID-19 cases in country inching closer to the 11,000 mark, with the Ministry of Health confirming 33 additional cases for Tuesday, May 11th, pushing the national count to 10,966. Of the new cases, 25 were confirmed on New Providence, 3 on the Berry Islands and Cat Island each, and 2 on Grand Bahama. 2 of the cases confirmed in the capital has a history of travel within 14 days. A further breakdown of the new cases indicating 22 infected are females and 11 are males. Active cases now at 742, with 55 of them in hospital. 50 considered moderately ill, 5 in intensive care. Health officials confirming another unfortunate death, COVID-19 death that is, a 68-year-old female of Exuma who died on Tuesday. Her death pushes the total death toll to 215. On the upside, 45 cases recovered on Tuesday, pushing the total recovered cases to 9,932. Despite being turned away at Loyola Hall on Tuesday and not being able to receive his second jab of the Oxford AstraZeneca COVID-19 vaccine, Progressive Liberal Party leader Philip Davis continues to encourage members of the public to take the vaccine. However, many residents are still hesitant about the vaccine for any number of reasons, one of them being the uncertainty of potential side effects. Mr. Davis reminding that it is not unusual for there to be side effects when taking the medication.
It is true that we all react differently to medication, and any medication you take. If you look at any medication that is prescribed, any prescription drug that you get, when you read the instructions, they always warn you of side effects. So there's no medication one takes that one is not exposed to some side effect. It's just to minimize that, and then in the instance of where we are sensitizing a pandemic of national import, the government ought to put in place some protocols to address persons who may have some side effects from the vaccine.
Many residents are also reluctant to take the COVID-19 vaccine because there is no liability or insurance coverage from the government or the manufacturers. To help ease those fears, Mr. Davis gives the following recommendation to the government.
The liability in the sense of injury to a person vis-a-vis the need to be vaccinated, I think falls in favor of being vaccinated. The fact that one may fall ill, I think, again, the public sector, the government ought to consider, if there are what I call side effects from the vaccine, there should be a program in place to address those side effects.
Meantime, the PLP leader was also asked if the party would hold a convention. He told reporters that it will depend on the COVID-19 pandemic, where we are as a nation, and if a convention can be safely done. That said, he adds that ratification for the remaining PLP candidates will be done shortly and that the PLP will be ready for election whenever the date is called. President of the Bahamas Union of Teachers, Belinda Wilson, expressing concern as more schools become impacted by COVID-19, disrupting learning on a daily basis, she says. Now, as of April 20th, Director of Education Marcellus Taylor advised that there had been 15 to 20 suspected or confirmed cases of COVID-19 in public schools across New Providence. Minister of Education Jeffrey Lloyd also said he had no concern that an outbreak could occur at schools open for face-to-face learning around that same time. But the BUT president begs to differ.
The fear, anxiety, and concern is growing increasingly among teachers and students, as there are some schools that have been impacted for the second or third time. There seems to be community spread, and schools can easily become a breeding ground for COVID.
That said, the union's urging the Ministry of Education to close schools in New Providence and the Family Islands where numbers are growing, revert to virtual learning, revise a workable plan, reduce the hours in the school day, reduce the number of students participating in face-to-face learning, and if there has to be on-campus learning, let BJC and BGCSE candidates attend school only.
If there is a need for a full closure of all schools, then use the predicted grades to award grade 12 students their BGCSE certificates and give them the option of sitting the examinations at a later date. Ministry of Education, I implore you to move swiftly and systematically and deliberately.
Our news team also reached out to Education Director Marcellus Taylor, who says this.
We are in the process of making key decisions to ensure that everybody is safe and things proceed as they ought to. We've engaged over 200 stakeholders over the course of the last 2 weeks about examining this particular issue at this time. So I'm not quite sure what the DUT is saying, but we have engaged that process and we are now in a meeting with them right now as we speak, just informing them of the decisions that we are making.
Schools across the country closed last March due to the COVID-19 pandemic, but were later opened last October. Schools on New Providence, Abaco, Eleuthera, and Exuma were teaching virtually until given the green light to begin phased face-to-face learning in February. You're watching JCN News. Stay with us.